Hi, class. Hey, hi. I want to ask you a question. Um, what did you have for breakfast? And you, did you ever hear the saying that you are what you eat? Did you see these posters here? Some are of infants, and some are some foods with a lot of folate, some major micronutrients carried in our food. Is everybody seated? Good morning, class. Last week we studied about eating foods fortified or that have a lot of calcium in it, a major nutrient in our food, macronutrient in our food. It'd be greater than 500. We need this for great bone density, carry us through adolescence, and all the way to our old age. But today we'll be talking about getting enough of the micronutrient folate. Folate would be the more organic form, and folic would be synthesized form of folic acid added to cereals and breads and flours and vitamins. We need this women of childbearing age and women who are pregnant to prevent birth defects. Raise your hand if you've ever heard of this. Hi, Susie. You can tell us about it. Really? Yes, yes. And the thing is that just eating some foods that have a lot of folate may prevent it. Has anybody heard of spina bifida? That would be one of the diseases, congenital diseases that form when we don't have enough folate, in most cases. I'll tell you a story. One time a patient had increased morning sickness, and anybody knows what morning sickness is and pregnancy is. You don't keep down your food, so you're losing your nutrients, and then you don't have enough folate due to nothing beyond your control. So due to this, they call it emesis, she was unable to absorb the folate and other nutrients, and the doctor had to order intravenous nutrition. So she got that through one of her major veins in her neck. So next we'll go over how does a woman get enough folate in the childbearing age, which is imperative. And also the goal of this class is to develop a diet to prevent folate-related birth defects. So that will be our goal. So we're going to develop, everybody's going to develop a diet. Next, we'll get our evidence, our facts, from evidence-based data, peer-reviewed articles, and the National Institute of Medicine, and a textbook called The Best Nutrients. And I'll relay this on a PowerPoint presentation visual. And on this PowerPoint here, I'll point out the factors important before you get pregnant. The diet full with folate-rich foods plus a variety of nutrients. increase folate during the first 28 days post-conception. Can prevent neural tube issues in the fetus, which cause paralysis and decreased brain tissue. The 28 days, a woman may not even realize she's pregnant. 400 micrograms of folate or a supplement of folic acid is recommended, the recommended daily allowance for all women capable of becoming pregnant. Again, food sources are a lot in spinach, so other grains, fortified grains and cereals. That means probably folic acid is added to the cereals and bread. So next we'll discuss folate-related congenital diseases. Neural tube, embryonic tissue that develops into brain and spine. Those are diseases that can be that occur if you have decreased folate. Spina bifida again, the spinal vertebrae fails to close and the spinal cord and tissue just bulges out right out of the back. There's a picture over here. And cephalai is a fatal disease where part of the brain is missing. So those are all definitions: neural tube, spina bifida, and encephalai. Next, so to learn this and engage in it, so we'll retain it. The class will form groups of 4, and we'll construct a plate, whether it be in pictures or in diagram, rich in folate. Add a heading to the amount of folate in which food. I will ask each of you what type of meal they ate the day before to see if you're practicing a nutrient-rich diet. And also you'll be required to write a 400-word essay on folate and pregnancy, and then maybe some short definition quizzes. So to point out the major things we discussed today in conclusion: diet, supplements, morning sickness, and you can write down major sources of folate and the definitions, and I'll repeat those. It was great to have you. And let's see if anybody is able to write down the definition of spina bifida, neural tube. Okay. Great. Good job. Okay, just pass those all up and I'll look at them. See you soon.